as you guys know, officially, we're not treating any illness or disease. And so this may or may not even could be your experience with anything, but I can expand this a little bit more to just sort of some generalized pain, because pain and itching run down some of the same pathways in our body. And those of us that sometimes have a lot of itching, which I do, sometimes it's painful, as you know. And so I think that this might be a really good protocol for many of you that have suffered from shingles or bad pain, itching, anything like that. For me, what I have learned is that there is that nerve pathway that if you can identify the one that's really bothering you, you can place multiple patches along that pathway, and it can be very effective. So I literally just began to do a bit of experimenting, following some of what David Schmidt talks about in regard to some of the patch placements. And what I decided that worked really well for me was to use the Icewave patch and put the brown on the focus of the pain if I could find it. And then put the white patch, as we know, somewhere either above or below at 12 or 6 o'clock, about 2 inches above or below that area of greatest pain. And then sometimes for serious illnesses and pain, you've got to have more. And so what I learned is that I could use the X39, the X49, and the Eon, and literally just sort of line them up along that nerve pathway that was so bothersome. And I had amazing results. As we know, some of these diseases can be so painful, and it's wonderful if we don't have to take something that can make you feel goofy or knocked out or not feeling good. And so you get a wonderful result. At least I did. Hopeful many of you could as well. And some of my patients can vouch for that too.
56-year-old patient of yours with cognitive issues. And you were finding that with the X39 and the X49, I believe, you had great results, and we'd love the placement for those two.
Yeah, so I think for the most part, because we know from David Schmidt's studies that X39 and 49 will probably give us maximal benefit if we're using them along the midline. So the back of the neck and under the belly button. And I have heard him say often that he puts X39 on the back of the neck and 49 about 2 finger widths below the navel, the belly button there. And that you can then get the greatest systemic effects. Now, if you're really looking for something that's more specific, like you have an area of pain, we all know we can put those pretty much anywhere on the body. But I think to get the maximal benefit, including for cognitive issues, this is what I recommended for my patient. And these were not major cognitive issues, but just lapses and not being able to remember words and things that many of us, do feel from time to time. And she felt a true sharpening of her cognition by using X39 and 49, 12 hours on in the day, 12 hours off at night.
So, Patty, if you would tell us about your patient who has so much more energy now that her workouts are completely revolutionized.
I think that both, again, the X39 and 49 can be super helpful. And I always want my patients to start with X39. Marcy and I sort of created some protocols where we use X39, 49, and Eon. Eon's our companion to the stem cell patches. I think, like Marcy said, I love that, Marcy, turbocharged. Then we add whatever other additional patch may be helpful. But my patient has had great results. Excuse me, I've got just a little sip here. And she just said she wakes up every morning and she just feels like that. It's just amazing how much better she's doing.
What's that called, Dr. Patty? Methylation issues. They don't have a gene that works right. Those cells your own cells, because we're activated through light, slowly start taking it up. And maybe Dr. Patty would like to finish talking about it, because that was interesting how glutathione can slowly activate in our system to detoxify it.
Yes, that's true. And about 1/4 of all of us, I'm not sure what Marcy said just previously, briefly, but about 1/4 of us all have what we call methylation issues. And it sounds really fancy or hard to sort of wrap your head around, but basically it just means we don't detox. And normally the way our body works, chemically, some of you can go back to your high school chemistry, or maybe none of you have even had chemistry, but it's pretty easy just to think about. There's just a particular chemical group that normally latches on to a lot of toxins in our body. And those of us that have those methylation issues, it just doesn't latch on as well. And so I just pretty much assume if 1 out of 4 people at least has it, I know I have this issue. I just assume that probably many of my patients, particularly those of us that tend to have more chronic illness, we really don't detox as well. That's one of our problems. And so that's why it's so wonderful to have access to the glutathione patch, because I was never able to take glutathione. I was too sensitive to it, and you don't absorb it very well anyway. So the patch is just a wonderful way to help us to continually detox. We have a good lifestyle too, right? We don't want to bring in a lot of toxins that we have to detox. So we try to have good lifestyle choices, good eating habits, eating organic, drinking good water, purified water, and so on. So we don't bring a lot of toxins into our body, but we're just going to have some toxins there because we live in an environment, the air and the water and the food often has toxins. And so we need a way to detox. And I just love glutathione. That's one of my favorite patches, and my husband's too.
Beautiful. Thank you so much. And would you finish what you were going to say about your patient who has found incredible workout results? And again, always tell us where the placement is for the patches, which is so helpful.
Yes. So I think it's really good. One thing, just a little tip that I've learned through doing some DNA testing on myself and some of my patients, but one of the best ways you can help your brain, sort of going back to your brain, is to try to do a workout before you actually eat your breakfast. Now, you have to make sure your blood sugar is stable. You certainly need to speak to your doctor about this to make sure that you're not, there would be some people that might be contraindicated and not the wise thing to do. But if possible, if you can do a workout before breakfast, that's helpful. So this particular patient of mine, that's what she was doing. We were advising her to do this. And so what she would do is she'd get up in the morning, drink plenty of water. She would put on her X39, the back of her neck, X49, 2 finger widths below her belly button, and she'd go do her workouts. And then she would always top it off later after she finished her workouts with a really good protein smoothie that we had some recipes for. And it was just a dynamic, combination for her. And again, that turbocharged, love that word. That'll be our word for today. But it's the synergy of putting all that together was just wonderful for her. And so I've been starting to recommend this as well to other patients and even to myself. I don't do super charged workouts, but I do walking and yoga and things like that. And so on days I can, I try to follow that. I always start in the morning putting that X39 and 49 on to get myself going.
Patty, you have a 55-year-old patient who's had a lot of pain in his knee. And so he's using the patches. Would you tell us what you discovered and what you recommended?
Sure. So this patient has had chronic knee problems for probably 30 years, particularly his right knee. And so what we did is we started with the Eon patch, literally right in the middle of his kneecap, because he had pain pretty equally over his whole knee. And if he would have had maybe more pain on the right side, I'd have moved it a little bit more to the right side of the kneecap. Same thing, left side, move it a little more to the left side. But for him, it was just pretty much equally his whole knee. So we just smacked that little Eon patch right there on his, the middle of his kneecap. And then he also had some issues just with sort of neuropathy in his leg, particularly his lower leg from the knee down to the ankle. And so we decided to just try again. That's what I love about medicine. And I've said this before, if any of you have been with me in a Zoom meeting before, but it's like, medicine is not just a science, it's an art. And so, and you as the patient, you research so much about yourself and you learn so much. And I, as a physician, like to be a partner with my patient. I have some knowledge, they have some knowledge, we put it together. And so that's why you can begin to do more of the art part. We listen to David Schmidt, we follow his instructions, we follow the instructions on the patches that are on the website. But we also can begin to say, you know what, I've got this specific issue for me. Just like Susan said, let's think about what we could do. And if you have a functional medicine doctor or a practitioner that's working with you, that's holistic, then, get their input and sort of put it together. And so that's what we did. And we found, again, that area of greatest pain on the front of his mid shin is where it was. And we put that brown Icewave patch. And then we tried the white patch. And if you haven't been able to go onto the website, if you're looking at Icewave patches on the website, scroll all the way down to the bottom and you'll see a tab called usage. And if you click that on, there's lots of instructions. There's video to show you how the clock method works with the Icewave patches. And what that means is, if it's a nerve pain, like I said before, and here's the worst pain, you're going to put that white patch either at 12 or at 6 to be on the nerve. But if it's the knee, for example, or the shin, what we did with him is we moved it around. We tried it at 12 o'clock. We tried it at 3 o'clock, 6 o'clock, and 9 o'clock to see which area would be the best place to put that white patch. Because what we're trying to do is interrupt that energy and electrical signal of pain. And so that's what we did. We experimented with where would be the best place to put it. And David Schmidt demonstrates it so well. You just take off just one side of the patch so that you still have the other sticky part covered. And you just try it in those 4 places until you find the place that the patient says, that's the best spot. And then you take off the other sticky other side so that you've got your full sticky patch and you stick it on there at that spot. And so that's what we did with this patient. And he was just very surprised that literally for most patients, it's a pretty instant thing where there is improvement at the very least. And for some patients, they go, I don't even feel the pain or barely feel it. And he was so amazed. He could walk, he could get around better, just almost instantly. And then has been doing that and having great success with it. So I would highly recommend a little bit of artistic on your part, and you may be able to make a big difference in that kind of pain using Eon and Icewave.
I know that you have a patient who found a tremendous benefit with Nirvana. Tell us about that, please.
Yes. And, I think one of the biggest things in our society now is that people do suffer from depression and mood swings and anxiety, and it's just rampant. And the problem is that the drugs that are out there that are officially FDA approved have so many side effects. And I always want to look at benefit and risk for my patient. And I'm like this. Most of my patients are very sensitive to medications. And if I take something like that, I almost always get a side effect that's worse than the medication. And so when I began to hear about Icewave for pain and Nirvana for mild depression, and again, I do want to say at this point someone that has serious depression, you must be working with your doctor. We want you to be safe. But there are many people that just have a bit of sort of up and down. You have a better day, a worse day, but it's that mild form of depression. And rather than getting on a big drug that has a lot of side effects, things like making you feel very groggy, your brain feels dull, you feel like you're sort of in a stupor, you have no sex drive. Sometimes you are sleepy, but you can't get deep sleep. Your energy levels are just plummeting. So those are the kinds of side effects we do not want to have for quality of life. And yet, sometimes we get so desperate when we've got depression and just don't feel real good. So after reaching out to your doctor, making sure that you're safe and good and all of those things, Nirvana can be a great choice. And the reason is because it doesn't have the side effect potential. And so you're looking at benefit. There's no drugs in these patches. Remember, I couldn't get my head wrapped around that at first. This stimulates your own body to release more endorphins. And that is what helps not only with pain, Nirvana can help with pain too, but also with our moods and how we feel, and just a greater sense of well-being. And so I had a patient,
Thank you.
a young woman, same things, that she's tried this and it's been so helpful to her, and many things haven't worked. And we do know with Nirvana that there also is the tablets that you can take as well. And that can be very helpful for people that need even more help in addition to the patch.
As you told us in the last show, pain-free. So tell us what your protocol is for yourself.
Well, that's how I came into Lifewave, was through a patient of mine who told me about how IceWave patches were helping her with her pain. And I listened to her. Her gynecologist had recommended Lifewave to her. I reached out to her gynecologist and began to talk about, something that really could help pain, but it wasn't going to have all the side effects of typical pain medications. And so as I began to research, I felt like I went back to medical school, because I really couldn't believe that it would work. But I found that actually we had lots of studies out there. It made sense. The doctor I spoke to had patients and herself major help. And so I began to look at IceWave for myself. And that is where I first started with X39 and IceWave. And I have pain at night, and I don't accept the diagnosis of MS as this is my disease forever, but I do have symptoms of it right now. And one of the worst symptoms is pain at night. And many of you that have pain and itching know that it gets worse at night. Those of you that have depression often will notice it gets worse at night. And that's because our cortisol levels fall at night. And that actually some cortisol in our body is good. We don't want too much to be too stressful, but we need some. And as those cortisol levels fall at night, sometimes you just feel like, the pain's coming back, the itching's coming back. I don't feel happy. And so we need to recognize that. It won't upset us so much, but we know then that we look at it. We might want to use Nirvana at night if that's the case, rather than during the day. Same thing with IceWave patches. And so I looked at the protocols like we talked about before, and there is a protocol for full body pain, which is basically what I was getting at night. And I patched the bottoms of my feet, and I began to follow the protocol, tried it on my wrists, tried it on my elbows, tried it on my shoulders on either side. And I love what Marcy says. It's like you bookmark it. So on the bottom of your feet and ultimately the top of my shoulders. And I was stunned. The first night I had about a 50% reduction because I had the top here. And so as I began to move it up to the elbows, and that actually works great for me too, and my shoulders, I was able to sort of just, book into that pain and interrupt those energy signals and electrical signals like we talked about before. And I have about an 80% reduction at night, which is just incredible to me. And I'm so thankful for the IceWave patches. I don't know what to do. And then when I get additional pain, sometimes that's what happens with autoimmune diseases. New things crop up. I know I have Icewave, and I told my husband just a couple of nights ago, I said, honestly, I just don't know what I'd do without Icewave. So, and I do think it's important though to make sure you're using X39 at the very least. I use I'm like Susan. I just I have my patch arsenal, and I use all the patches off and on as needed, and some of them every day. So